I actually wrote a story from our last interview called Local Doctor Helping to Treat Pain, Sleep Apnea, and Ailments with Medical Cannabis. So let's start there. I know you have the clinic. Give us the clinic name and tell us a little bit about, I guess the first question is, who is a candidate for medical marijuana, and how can they get this card that everyone's talking about?
So first of all, the clinic, thanks a lot to have me back on. I appreciate it. The clinic is in Boca Raton in Delray, Delray, my Delray office and my Boca office. It's on Glades and Lyons in Boca, and then Delray, it's off of Congress between Atlantic and Linton Boulevard. The clinic has done very well. In fact, so far, I've probably wrote about 175 prescriptions, and I have about 100% success rate with this clinic. I have patients coming back into my office. They're been on pain meds forever, back pain, neck pain, anxiety, can't sleep at night, sleep apnea, all kinds of different things that are affecting them. They've been on these doses now for a period of time. They get their card, they go to the pharmacy, they finally get their medication, it ships it to their home.
Oh, nice.
Once they get everything set up. And they're very, very happy. They're coming back in. They're asking me, where do I put my narcotics? How do I get rid of these, Doc? Because I don't want these anymore. No more oxycodones, no more hydrocodones, no more OxyContin, those kind of things. So they've been doing very well on it. The medicine's working. The dosing is working for them. They have a different dosing for daytime so they can still function and work. And then at nighttime, they have a little bit different dosing to help them sleep at night. And the patients are coming back, they're able to sleep. These are people that work up all night, they couldn't sleep, they were taking pain pills, they were taking, Ambiens, different kind of medication to sleep, and now they're no longer doing that.
It's funny you mentioned sleep, because that's kind of one of the best prescriptions for getting better from ailments is sleep. And if you're not sleeping, the body doesn't have a chance to recharge. And I didn't know that, sleep apnea is also on the list for medical marijuana. So they come into your office now, and it's CAM, you call it, right? Clinical for Compassionate Alternative Medicine.
Yes, it's called CCAM.
CCAM,
yes.
That's what I meant.
Yep.
And they just come into your office, and you see them for whatever ailments they describe to you, and at that time, do you make a determination if you can move this forward with the state? Is that how it works?
Yes, they have to be a candidate, obviously,
Okay,
and they have to be able to fit into that candidate process. But once they come in, they have their their treatments with them. They bring their MRIs. They bring, whatever's going on with them. We go over their history. We go over their physical exam. We look at their MRIs, all their studies and whatever. If they fit that process where they're a candidate for the state, which is kind of still iffy of what really is a candidate, because they throw it out there that pain could be kind of there, but you have to kind of put it as what kind of pain it is.